I'm Dr. B, pediatric neuropsychologist.
And I'm Catherine Mukes, licensed professional counselor. And welcome to Let's Talk.
Today we're going to be talking about caregivers and the stress surrounding being a caregiver, whether that's to an elderly parent, whether that's to a child, a young child, or whether that's to another adult who requires support. Or with children, it could be a special needs child, which often requires increased resources. So we're going to talk about ways to manage caregiver stress today.
And the first part of being able to manage your stress as a caregiver is to first recognize when you're starting to experience signs and symptoms of potential burnout. And that can take many different forms. And a few of the things that you can look for is your level of irritability increased, or is your tolerance lower than normal? Are you feeling like you're neglecting your own personal needs? So maybe you're not eating when you're hungry or need to eat. You're not managing your self-care in ways that you normally. Maybe you're neglecting your own medical appointments and different things like that because you're running someone else back and forth to theirs or tending to their care.
Mm-hmm. Some of the other signs of caregiver kind of burnout would be abuse of alcohol or any other type of illicit drugs, but particularly alcohol, because there's, definitely easy access to it. So if you find that you're drinking alcohol more than typical and you're in a caregiver situation, then there may be a sign of burnout there. And also having difficulty with sleeping. So if you're sleeping too much or you're not getting enough sleep, that can be another sign.
Or like the alcohol, if you're finding that you're relying too much on sleep aids to be able to get to sleep. So maybe you're taking medication to help you sleep more frequently and at higher doses. Those would definitely be triggers. And one more that comes to mind is just overall exhaustion, feeling fatigued and tired all the time, either emotionally or physically. Those may be some signs that you are stepping into the arena of caregiver burnout.
So what do? You have this elderly parent or special needs child or adult sibling that really requires a caregiver, and you are that caregiver and you are experiencing burnout. Is there anything that you can do? Yes, there are a few things that you can do, and the main thing that it comes down to is taking care of yourself. So in order to be able to provide that care for someone else, you have to take care of yourself. It's just like, with the an airplane.
That's one of my favorite analogies,
I think
right?
you might have said that before.
When you're on the airplane, before you can help anybody else with their oxygen mask, if the cabin loses pressure, because everybody's freaking out, right? We're under stress. You have to first put on your oxygen mask, because if your oxygen mask is not on and you're not getting any, if you're not being cared for, you do not have anything left to care for someone else.
Absolutely.
So self-care comes in lots of different forms, right? One of the things that we think about is being able to take breaks. For some of you, that may look like having to have a night away and enlisting the help of some other type of person, respite services or something like that, to help you to care for that person while you get a day away. For some of you, it just may be having a few minutes, maybe having that hour to spend in the bubble bath while you're listening to your favorite music, or being able to sit out on the porch for a while and read that book you've been trying to get into. So just being able to take a break from the active role of caregiving nonstop is going to definitely be one tip that will be helpful for you.
Right. And just setting realistic expectations for what you're able to do. Not overburdening yourself, or if you find yourself being overburdened, being able to ask for help.
Absolutely.
Another thing that came to mind to me is knowing kind of the sleep behaviors for the person you're providing care for. So for example, if they are a person who wakes up early in the morning, then you may stay awake 15 minutes later after they go to sleep to kind of give yourself some self-care. If they are a person who wakes up later and stays up late, then maybe you wake up 15 to 20 minutes earlier to provide some care for yourself.
Absolutely. And one of the other tips is to seek out support, whether it be in the form of family or friends that are able to be there with you in the thick of things, or being a part of a support group of people who are going through the same or similar types of situations as you. Because sometimes when we're in a caregiver role, especially when there's extreme needs involved, we sometimes feel like we're alone and can become more isolated. So being a part of a support group gives us the added benefit of having people around us who know and understand what we're going through. And it also gives us the opportunity for having other ideas or ways to be able to deal with that stress and burnout.
Absolutely. So just to recap, some of the symptoms of caregiver burnout include irritability or anger, things of that nature that happens either towards the person you're providing care for or to others. Neglecting your own personal needs, so your health, going to doctor's appointments,
eating,
sleeping, those things. Engaging in abuse of alcohol or medications that are meant for sleep, but abusing them, and in general just having an emotional and physical exhaustion. And some of the tips that we discussed were taking breaks, understanding your limits, having realistic expectations and asking for help when you need it, and looking for support groups or individual that can support you, and talking about shared experiences and other ways or different approaches for kind of solving problems that may come up while you are in this role as a caregiver.
Absolutely. So we hope that these signs and symptoms of potential burnout, as well as the tips for helping to beat burnout, have been helpful for you. If it has been, make sure you give us a thumbs up. Share it with a friend who may be experiencing some caregiver burnout. And also drop us a comment on what you think about this video, any feedback, and any questions you may have, or topics for other times. So it's been a pleasure talking with you today.
Yes.
We'll see you next time.
See ya.